Assalamu alaikum. I am Dr. Usman from 2018 batch, and these are my group members, Dr. Hunzla and Dr. Usman. And today we are presenting our CVS PPT. So let's start. A patient with cardiological problem is likely to have one or more of 6 main symptoms like chest pain, shortness of breath, fatigue, palpitations, syncope, and edema. Other symptoms like cough, hematopoiesis, cyanosis, limb pain, and skin discoloration. So after that, we will go for physical examination of cardiovascular system. General appearance of the patient. Measurement of the blood pressure, examining the arterial pulse, examining the jugular vein, and examining of the precordium, examination of edema. General appearance. First, look for the breathlessness, signs of anxiety or discomfort. Cyanosis, jaundice, and anemia are very important. Important clues of cardiac diagnosis can be obtained from inspection of the patient. The examination begins with evaluation of the general appearance of the patient, including his age, height, weight, posture, behavior, and respiratory patterns. Chest shape, pectus excavatum, pectus perinatum, skin color, pallor, anemia, cyanosis, and extremities, edema, clubbing, splinter hemorrhage, face like xanthema, high facial coloring, cyanosis, and conjunctiva, anemia, jaundice, or these. These are some major signs and the doctor should observe in the patient. So, and the examination of the hands. You should examine for the clubbing, tobacco staining, and peripheral cyanosis. Cyanosis is a bluish discoloration of the skin and mucous membrane resulting from the abnormal perfusion by either an increased amount of reduced hemoglobin or abnormal hemoglobin. There are 3 types of cyanosis: central, peripheral, and differential. Clubbing. Clubbing refers to the swelling of the soft tissues of the terminal phalanx of digits with subsequent loss of normal angle between the nail and the nail bed. Examination of pulse and heart rate. A pulse is produced by the ventricular contraction during systole. 3 fingers matter. Palpation with second and fourth fingertip. Palpation of the common carotid artery, radial artery, femoral artery, pulpitory artery, tibialis posterior artery, and dorsalis medius artery. The thumb of the examiner should never be used to take the pulse, as it has its own strong pulse, which might be mistaken for the patient's pulse. The pulse of the carotid artery should never be palpated bilaterally and simultaneously, because each side separately risk of compression of the vessel, cerebral hyperfusion, syncope, risk of the hyperstimulation of the carotid, sinus flux, bradycardial, low blood pressure, cerebral hyperfusion, syncope. Assessment of arterial pulse. Abnormally can be in the rate 6 to 10 BPM, rhythms, regular, irregular volume, character conditions, vessel wall, and radiofemoral delay. Measurement of blood pressure. Blood pressure should always be measured in both arms. Jugular venous examination technique. Ensure the patient is at 45 degree. Examiner stand at the right front table. Ask patient to turn their head away from you. And assessment of jugular venous distension. JVD is when the increased pressure of the superior vena cava causes jugular vein to black, making it most visible on right side of the person's neck. Examination of eyes and mouth. So the doctor should examine the patient for central cyanosis, pallor of conjunctiva and xanthema. Dr. Hunzla, please.
My name is Dr. Hunzla. May I know your name, please?
Walaikum assalam. My name is Usman.
And your age?
I'm 24 years old.
I'm going to do some cardiovascular examination on you. Do I have the consent to do it?
Yeah.
So first of all, we have to do a bedside examination. We have to check for the breathlessness sign of cyanosis or any scar on the chest. That is from the bedside. Then we have to look for the hands. Could you please forward your hand for me? So here we have to look for tobacco staining and also peripheral cyanosis and also splinter hemorrhage and also clubbing, as it is seen in case of chronic heart disease and infective endocarditis. Then we have to check for capillary refill time. So we have to press the capillary for 10 seconds and leave it. Within 2 seconds the capillary should refill. That's the normal capillary refill time. Then we have to check the patient radial pulse. We have to measure the rhythm and also the rate. So we have to hold it by our 3 hands. And then we have to check both the radial pulse for radial pulse delay, as it is seen in case of aortic coarctation. So we have to check both the impulse, radial pulse together to check for any delay or not. Then we have to check for any collapsing pulse. In this we have to raise the patient hand. First of all, we have to assure that the patient has no pain in his shoulder. So do you feel any pain in the shoulder? Could I lift your hand? So we have to hold the radial pulse and jerk the hand. So there will be a collapsing pulse. And mostly we do it to check for aortic regurgitation. So next we have to measure the blood pressure, as we don't have the apparatus, so we cannot do it over here. Then we have to check for carotid pulse. We have to check carotid pulse once at a time, because we cannot press both the pulse at its supplies circle of Willis and also the brain. So we cannot press it both at one time. So how we have to do it? We have to place our thumb over here and check for the rhythm at one side and also the rate. Okay. Then we have to auscultate the carotid artery for bruise. Then we have to check for JVP. Is the JVP raised or not? We have to ask the patient to move his head. First of all, can you please lie down? And we have to ask the patient to move his head at an angle of 45, so that we can see the JVP. If the JVP is raised, if there is distension in jugular vein, then only we can see the raised jugular vein. So you please turn it to 45 angle. And then also it is raised in case of right heart failure. Next we can check for hepatojugular reflex. We have to ask the patient whether he feels any pain in the stomach or not. So do you feel any pain in the stomach? We have to press this abdomen and check for any raise in the pulse, in the JVP, whether there is any distension of jugular vein or not, as it is seen in the case of right heart failure. Could you please sit down? So next we have to check for the general appearance, general physical, facial facial examination in which we have to see the eyes for xanthelasma, conjunctival pallor, and corneal arcus. Conjunctival pallor, it's most common feature of anemia, and corneal arcus, it is seen in case of hyperlipidemia. The arcus will be swollen, and the pallor, the conjunctiva will be paler, like below if we check. And then we have to check for the central cyanosis of the tongue. So could you please open your mouth and lift your tongue upward? So we have to check the central cyanosis of the tongue. It is seen in case of heart failure, the right heart failure is also in left heart. So could you please come down with measurement?
Specific examination of cardiovascular system. Epicardium cardiac examination. The basic components: inspection, palpation, percussion, and auscultations. Inspection. Pay attention to the chest pain of the patient, chest shape of the patient. So it might have a pectus excavatum and pectus cranitum, shortness of breath, walk, or the at rest position, sitting upright, able to speak, and visible impulse on the chest wall for vigorously contracting ventricles. So chest wall deformities: pectus cranitum, pigeon chest. The sternum and the ribs are prominently in outward position. Pectus excavatum, the sternum and ribs are mentally in inward position. Barrel chest elevated, anterior posterior thorax diameter. The anterior posterior to transverse diameter is 1:1 seen in COPD. Thoracic deformities can be affect the function of the heart and lungs. For patients, apical impulse, thrills, and apex beat. The apex beat, also called the apical impulse, is pulse felt at the point of maximum impulse. The PMI is normal over the left ventricular apex in the mediovascular line at the fifth intercostal space. Peristernal lift. The pericardial motion in the lower sternal area usually reflects RV motion. Right ventricle pressure overloads, for example, in pulmonary cyanosis or volume overloads, causes the sustained outward lift. It is called parasternal lift. Thrills. Palpable vibrations. It can be palpated in mermaids of 4th degree and above. Auscultation sites. There are 4 main important areas used for the listening of heart sounds. These are aortic area, second intercostal space to the right of sternum, pulmonic area, second intercostal space to the left of sternum, tricuspid area, fifth intercostal space to the left of the sternum, mitral area, apex. The intersection of fifth intercostal space with mid-clavicular line. And at the last, the doctor will check for the pedal edema over medial melonus of 5 cm with it wet thumbs. Apply pressure for minimum 30 seconds and look for dimpling, pitting edema. So, doctor, please perform.
Now we have to do the specific examination, in which again we have to see the any specific to chest. Is there any chest deformity or not? In the chest wall, then we have to do the palpation, in which we have to place our hand. For apex beat, we have to place our hand at 5th intercostal space, mid to mid clavicular line, to palpate the apex beat. And then we have to check for parasternal heave, but the patient should lie in the angle of 45, but we don't have the bed fine. So for parasternal heave, we have to place our finger in the second, 4th intercostum, left sternal edge, to look for parasternal heave. Parasternal heaves are present in right ventricular hypertrophy. And also we have to assess for thrills in all the 4 walls. The first wall is at the 5th intercostum, mid to mid clavicular line, and the second tricuspid, it's on the 4th intercostum, left sternal border, and pulmonary valve is at aortic at second intercostal left sternal border, and aortic valve is at second intercostal right sternal edge. Then we have to auscultate for these valves. So please, no. Throughout all the four valves of the heart, we have to auscultate. Then we have to also auscultate the carotid artery for ejection systolic murmur. So ejection systolic murmur are mostly heard at aortic stenosis. So then we have to check for ascending manure, aortic murmur mostly, and also the ascending manure for mitral murmur. Then we have to check for pedal edema, and for pedal edema, can I check your leg, please? So we have to check it bilaterally.
So, doctor, please
So I
summarize
want
your-
to summarize. Thank you so much for your cooperation. So I examined Usman, age 24, for cardiovascular system. On inspection, no peripheral markers of serious disease. His pulse is regular. On palpation, undisplaced epics, no thrills or heaves. On auscultation, he has normal first and second heart sound with no added sound. It was a normal cardiovascular exam. For further investigation, I would like to go for ECG, CBC, and blood pressure. Thank you so much.